Good afternoon, Yorktown. It's Supervisor Matt Slater coming to you from Town Hall with another community COVID update. Before I provide information on where we stand today, I want to welcome a very, very special guest who's joining us today, my good friend, Dr. Robert Amler of the New York Medical College. Dr. Amler has an incredible biography, incredible experience. Not only is he the dean, he's the dean for the School of Health Sciences and Practice, as well as the vice president for government affairs for New York Medical College. Previously, he was the regional health administrator for the U.S. Department of Health and Human Services, where he secured supplemental SHIP funding for Medicaid programs. He also oversaw hospital emergency preparedness and directed federal medical emergency assets during heightened external threats to the region. He also served as the chief medical officer at the Center for Disease, that's the CDC, for Toxic Substances and Disease Registry. Those are some of the highlights of a very, very decorated career. But Dr. Amler, thank you so much for joining us today. We really appreciate having you here and providing some great insight to our residents.
Well, thanks for having me, and I'm really excited to be talking to Yorktown this afternoon.
Awesome. And if the name sounds familiar, folks, it is. It's an amazing house to be part of if you're part of the Amler house. His wife is Dr. Shalita Amler, who we've had on the show as well, who is the Commissioner of Health for Westchester County. So we have two of the best experts that you can find joining us to provide important guidelines and instructions for our residents. So today we've had 19 new active cases confirmed for the Yorktown community. That brings our total to 168. And I want to show, if I can, let's see. I was going to show the slide, but it's not coming up right now. But again, that's 168 that we have today. And that since November 2nd, we started at 33 active cases. And so here we are 18 days later, and we've grown from 33 cases to 168 cases. So we've seen quite the climb here in Yorktown, and unfortunately, it continues in that direction. We did receive a report from Northern Westchester Hospital today. Currently, there are 14 COVID patients that they have reported, 0 in ICU. And Northern Westchester Hospital is classifying their operating status as normal, which is great to hear. As a reminder, there are cluster zones that have been established by the state of New York. Though there are cluster zones in some of our neighboring communities to our west and south. City of Peekskill has a cluster zone, as well as the town and village of Ossining has a cluster zone. We've mentioned this before. I just want to reiterate it. Cluster zones are determined by the state of New York by infection rate. It is not done on a wider scale. They're really honing in on zip code and census tract data to make it very specific to specific neighborhoods where they see the community spread and the infection rate. And so we showed the maps before, I think it was yesterday. We showed the maps of Peekskill and Ossining. There's also cluster zones now in Tarrytown. There's cluster zones down in Yonkers, New Rochelle, and of course over in Portchester. All but Portchester are yellow cluster zones, so minimal restrictions. Portchester is now an orange zone, and as a reminder, it goes from yellow to orange to red, and those restrictions continue to increase until you get to that red zone, in which case you see significant restrictions, which of course is what we're trying to avoid here in the town of Yorktown. We have reinstated our state of emergency. That does not impact our schools. It does not impact our businesses. It does not impact our houses of worship. But it should be a strong message to the residents of Yorktown to take this very, very seriously. Earlier this week, the library board, in conjunction with our interim library director, Pat Parisi, as well as my office, made the decision to close to indoor hours. They are expanding for their porch pickup hours, though. So they're going to have porch pickup hours during the evening hours as well as on the weekends. And so you can visit the library website as well as the town's website to get that information. But today's less about those tidbits and more about our guest, Dr. Amler, and talking about some of the things that we're facing as a community, as a county, as a state and region. Dr. Amler, really interested to hear your insight into this virus. There's a couple of things I know you and I wanted to touch upon. Thanksgiving's right around the corner, and we've heard an awful lot about the potential, I guess, if you want to call it a threat, large gatherings would bring. And so in order to limit that spread and limit the community spread, there have been guidelines that I know Westchester County has released. I know the state of New York has released. I'd like to talk with you and get your insight as to what you would recommend for residents and our neighbors here in Yorktown with Thanksgiving approaching.
Well, thanks again for having me. It's a very important topic, and unfortunately, a little of bad news this weekend to go with the good news. I'll mention the good news downfield here. Look, the Center for Disease Control, the CDC, controls disease and protects not just Americans, but people worldwide. I used to work there for more than 20 years, as you mentioned. The CDC does not tell you what to do. It's not regulatory, but it gives advice. And I have to say, in my many years, I have not seen more stern advice than what has just come out about Thanksgiving. Look, we all feel safe and secure when we're home with our families, and we love to bring them into our homes and get together for Thanksgiving. Unfortunately, this year, it turns out, and research has shown, that more transmission of virus is actually occurring in people's homes when they gather with friends and loved ones than almost any other way. And so the CDC, looking at the prospect of a big Thanksgiving weekend with all the travel that comes with that and all of the public travel, as well as people coming together from different homes, different towns, different states, and other places, they look upon this Thanksgiving gathering, unfortunately, as a really big risk for transmission. We already saw that over Halloween, many families did not quite observe all the guidelines that were out there to try to reduce transmission. A lot of people got together in each other's homes. They felt like it ought to be okay, it ought to be good enough. Unfortunately, it wasn't. And you just noted that Yorktown itself just roughly 5 times increased the number of new cases, 5 times the number of cases in just a few weeks. And of course, we're concerned about schools, but it's actually more common that these cases land in schools because people go to school. But in fact, they're catching the virus in people's homes for the most part. So we've got to be really, really careful. CDC is saying, number one, don't travel if you can avoid it. Just stay home. It's sad, but it's necessary. Secondly, if you do travel, if people must have groups in their homes, perhaps people returning from school or from the military, they have to have someplace to go. Wear masks in your home. Don't share food and utensils. Try to separate the food. Try to separate into different bedrooms, different bathrooms. These are important guidelines. And if you go to cdc.gov, G-O-V, you can read these guidelines. Like I said, I've never seen more stern guidelines come out of the CDC before. So they really mean what they're talking about. They're not kidding around.
Yeah.
But now there's some good news too, and I'll be happy to talk about that.
Why don't you, real quick, I'm just going to mention, you mentioned schools. That's something I know I get a lot of emails and phone calls about. Our schools continue to work here in Yorktown on a hybrid model. I picked up my son from the elementary school this afternoon. He had a great day. But to your point, our schools have done a tremendous job in really making sure that the virus is staying out of our schools. They've taken great precautionary measures, both from Yorktown and from Lakeland. I've been in touch with both superintendents we're in touch on a daily basis. And they've done just a tremendous job. But to your point, what they're seeing is that when there are instances where the virus is being brought into the schools, it's not being necessarily, that's not the where it's being necessarily spread. And so that's the good news, because they're doing a good job with the mask enforcement. I mean, I've got a 5-year-old. Who would have thought that a 5-year-old would be able to keep his mask on all day? My son, he seems to be doing a great job with it, and according to with his teachers. Same with the entire class, but they're also being monitored. They're being supervised. They're making sure that they're properly distanced apart. And so I say it all the time, from the administrations of both Lakeland and Yorktown to the faculty and staff, just a tremendous job. But as we've seen, unfortunately, from those extracurricular activities outside of a school setting, unfortunately, we're seeing that's where the most cases are being attributed to. And then from there, they're being brought into the school. Right, Doc?
That's exactly right. I mean, look, could you catch the virus at school? Of course you can. You can catch it in the grocery store. You can catch it in a whole bunch of places. But by and large, as far as the data analyses have gone, and this is nationwide, the problem has not been centered in schools. There was a lot of worry about this when schools first opened. We heard lots and lots of dialogue about what would happen. And of course, when cases do occur, many of them will land in a school, because that's where kids go, that's where adults go when they're teachers or custodians, administrators, and so forth. So as is often the case in communities, the schools are in many ways a mirror of what's going on around them. And so you'll see, the cases, some of them will get reported out of the schools because that's where they get detected, found out. And I agree with you. I think that schools in general, and in particular schools in Westchester, have done really a fabulous job and a lot of hard work to keep these places and spaces free of infection to the fullest extent that they can.
Now, there has been obviously with some of the institutions of the cluster zones from the state of New York, and I want to make sure that we keep saying that, because I've gotten those phone calls too. The state of New York is the entity that declares and institutes these cluster zones. Now, we have seen yellow zones. There's a testing requirement for schools to operate. We have heard from superintendents from across the region that there's some concern about being able to adhere to those testing requirements that will allow the hybrid models to continue, both from an operational and logistical standpoint, but also a cost standpoint as well, that the school districts would have to take on. And then as we get into an orange zone and a red zone, in both cases, school districts are mandated by the state of New York to shut down. And that's why I continue to say to my fellow parents specifically, if we want to keep our schools open, please follow the protocols and the guidelines that we continue to hear, whether it's from town hall, whether it's from the county, the state, and of course the CDC. And the number one guideline we keep hearing about is wearing a mask. And so that's why we continue to wear a mask. Here in town hall, masks are required for all employees, which is why I'm sitting here with a mask on. It's not a political statement. It is a fact that it's a policy. And if I'm not following our own policies, then nobody will, which is I think an important one for us to lead by example with. But Doc, we also talked about some good news. So let's talk about some
Sure.
good news, because there is some good news out there, right?
Sure. Well, to your point just now, Supervisor, the community of Yorktown is fundamentally a sensible community with sensible people. We know that. We all know Yorktown. We all know people here know what they're doing, and they know how to adjust to situations as they occur. The good news, the real good news, is if you've been following these guidelines since back in March and you have not gotten infected, which means most of the people in the town of Yorktown have not been infected.
Correct.
What does that tell you? It tells you that for the most part, with all the virus flying around, you've been doing a good job, right? I mean, so far, you're okay. So wouldn't it make sense to just keep doing this for a little while longer before the next good news comes along. And we all know that's going to be vaccine. Now, you would have to be sleeping like Rip Van Winkle to not know, even though he was from the other side of the Hudson.
Yes.
We would all know that there's a vaccine about to come out. There's at least 2 companies that are this close to FDA approval. But the good news I got to tell you folks is there's about 3 more companies that are this close to approval. So we have a lot of companies with a lot of promising vaccines that are ready to go very, very soon. They're all in phase 3 trials. And what that tells you, if you don't know about phase 3 trials, is they already have to be very effective in order to get into a phase 3 trial. So we know these vaccines are effective. The main purpose of the extra trial is to make sure that they are also as safe can be. And that's the purpose of the phase 3 trial. Each trial is testing 30,000 people or more. That's a lot of people. That's a lot of vaccine, and that's a lot of effectiveness if you show the effectiveness in such a large population. I believe today the FDA, Food and Drug Administration in Washington, was actually reviewing emergency use authorization for one of the first vaccines out of the box. But whether that went through today or not, I haven't had a chance to check the news. But either way, this is a race to the top, and we're getting very close to the summit. Once that happens, you're going to start seeing vaccine going out there, and it's going to change the picture for the better.
Absolutely. I couldn't agree with you more. And that's why, like we said a little while ago, just hold on a little bit longer, because we are almost there. We are almost to that dawn. We see that light, but of course, sometimes it's always darkest before the dawn. So we just got to continue as a community to support each other, be there for each other, and work together to limit the spread. But on the vaccine, I don't know if you would be able to just comment a little bit further, but I do get questions also on distribution. And I just wonder, from your standpoint, with your experience, what do you see, and what's your take on what we should come to expect regarding vaccine distribution?
A couple of points on that, Supervisor. Number one, it's great to have a great vaccine, but if it stays in a vial and it doesn't go into my arm or your arm, it doesn't help us at all, right? The best medicine in the world doesn't work if it stays in the bottle. Same is true of vaccines. The next point is we have literally hundreds of millions of people in our country alone who need protection. Around the world, we need billions of people to be protected. And that is going to take some time. Even the best distribution system in the world takes time. And we're going to need to get vaccine into hundreds of millions of glass vials. That takes time. We need to make sure those vials are cleansed and sterilized so that there's no spread of just regular infection. We need to make sure they get on refrigerated trucks and planes and other vehicles so that the vaccine stays cold, which is how it stays effective. It loses effectiveness if it gets warm. So all of this has to happen, go out to distribution centers, and then we need the doctors, the nurses, the pharmacists, and the others who can give the vaccine and give it to people. People need to know where to go and how to line up. We need places for them to park. And fortunately, we've drilled this before. We've done this with flu vaccine and with many other vaccines over the years, but it's going to take some doing. So that's another reason to be patient and to keep doing what everybody's already doing. Because I remind people, even though we are sick and tired of this virus, the virus is not tired of making us sick. And we've just got to keep under wraps until you get that vaccine and the disease rates begin to decline, which they will.
That's great. And what do we say to people, because I've heard some, and obviously I'm sure you have too, but you have people who are concerned about accepting the vaccine once it comes out. what assurances can we give to them, if any?
No vaccine, no drug is perfectly protective or perfectly safe. That is just a fact of biology. We can't fight that. But by time the vaccine is licensed, it is incredibly effective and incredibly safe. And when you compare that against the deadly risk of COVID and the risk of passing it on and causing a deadly infection in somebody you care about, the majority of people who are mature adults are going to look at this thing and they're going to say, I'm going to take this vaccine. Yeah. Some people won't want to, and we understand that. I hope they do all right without the vaccine. But I think a lot of people are going to ask, what is the evidence the vaccine works? What's the evidence that it's safe? And when they learn and find out that it will be very safe, incredibly effective, and at that point, they'll make the proper decision. I think that we are a free country and people can make up their minds. And I would encourage everybody to learn what they can about the risks and the benefits of the vaccine. And like any other mature decision, I think the vast majority are going to make a mature decision to go ahead and get that vaccine.
And one of the other things that we've heard here in town hall from our residents, but also I think you've heard a lot in the media. Can you help us understand the difference between the COVID? Because I know that COVID's being compared to the flu in a lot of ways, especially in regards to the rate and its impact. Would you be able to help us understand the different, the potency of both the flu and COVID? And I know the other Dr. Amler was on a few weeks ago, and she made a point to our residents that the flu vaccine is just as important now as battling COVID and staying within the protocols of COVID. Would you be able to expand on that for us?
Sure. They are similar in that they cause the same symptoms in the beginning. And so when you show up one morning and you've got a fever, you've got a headache, you've got a cough, you have a stuffy nose, your eyes burn, you feel sick to your stomach, you feel achy all over, you've got a respiratory infection. But you don't know at the beginning if it's flu or COVID. If you've already had a flu shot, which I hope everybody's already gotten their flu shot or they're about to, because you really should, especially this year. If you've gotten your flu shot, it's far less likely that that's the flu. By comparison, it makes it more likely that it's COVID. So you're more likely to take those symptoms seriously and get checked out. If you don't know if it's flu or COVID, it's going to confuse you. It's going to confuse your loved ones. It's going to confuse your doctors. And it's just going to make the whole situation more difficult to manage. So that's all the reason in the world to go ahead and get that flu shot. And I hope you get the COVID shot when it's available too. Now, how are these two infections different? Well, remember how COVID was going to go away in the warm weather, just like flu typically does? Well, that didn't happen. So you know it's a different virus. It has a different pattern. It lives a different kind of life than the flu virus. The other thing that's different is in a typical year, flu will kill 20 or 30 or 40,000 Americans. In a bad year, flu can kill 80,000 Americans. Well, this COVID infection has already killed 250,000 Americans, which is more than 3 times as many. So even though they begin about the same way, COVID is much more deadly than flu. You can just say from the numbers. And if this were a flu year killing 250,000 Americans, this would be the most amazing go down in history flu year that ever happened since records were kept. So COVID is more dangerous, but there's this confusion of the two. And if anybody watching this evening has not yet gotten a flu shot, please go out and get it. You'll make life so much easier for yourself if you do get sick to be able to figure out what's going on. You'll make your doctor's job a lot easier too.
Yeah. One of the other things that I've heard and I've seen when people are not feeling well, and we're telling everyone, we keep saying it, if you're not feeling well, stay home. Even if you're feeling a little run down, you're just not feeling yourself, just stay home, contact your healthcare provider. But when they get to their healthcare provider, they have several tests, right? You've got the rapid test for COVID, which right now, it's my understanding from hearing from several of our testing sites here in Yorktown, they're actually running low on because we've had such an influx in residents trying to get tested. You have the PCR test, which is obviously which they send out to the lab to get the results. But there's also you also can be tested for the flu. Now, why is it important? Is it important to get all three depending on your symptoms?
If you can, it is certainly helpful if you can get all three. That's because there are two tests for flu, although they're done at the same time. There's flu A and flu B, which are really different viruses, actually. I mean, they're both named flu, but it's like two people whose last name is Jones or Davis, but they're not related.
Yeah.
I mean, they are generally related, but they're not related that closely. So, it is useful if you can get tested for all three if you're having symptoms. Testing, unfortunately, just like everything else in life, it's not perfect. It's pretty good. It's a lot better than it was, but you can get a positive test and think you have COVID, and it turns out you don't. You could also get a negative test and think you're okay. That's actually much more common, is depending on the timing of the test, you can get a negative test, think you're okay, but you actually are harboring the virus. You feel fine. And for the next several days, you could go out and infect a bunch of your friends and loved ones. So testing is not the be-all and end-all for COVID. There are certain circumstances where we want you to get tested, and certain circumstances where New York State will say you have to get tested. Yeah. And there'll be some circumstances where you say, well, it may not be required. It may not be recommended. I would feel better at this point if I could get a test. And there's nothing wrong with that. But just bear in mind that in that third scenario, the timing may be such and the type of test is such that it may not be the definitive answer that you hope it is. Again, eventually these tests will continue to get better and we'll have more accurate tests and we'll learn more about the ideal timing of tests. Not quite there yet.
Yeah, and I've seen I've seen recently within the last 48 hours, they now have rapid tests that you can take at home. Have you reviewed those? Have you had a chance to see that? What are your thoughts on that?
I'm just looking at that now, Supervisor. There is at least one test. It's made by a relatively small company. I think it's going to become famous real fast.
Yeah.
But this company has just gotten FDA approval for a home COVID test. Okay. And they say, I still need to read this, but they say that the big advantage is not only can you do it at home, but you can actually run the test at home.
Wow.
You can get your answer at home within, I think, about a half hour or an hour. That would be, if it's accurate enough, that will be a great thing. And like I said, all of these things are a race to the top. You've got practically every researcher in the country and around the world that knows how this disease works is working on better tests, better drugs, and better vaccines. And it is, as I say, a race to the top.
And considering your extensive experience in the medical field, I'm curious, how would you quantify the fact that within, what would you call it, 11 months, if you wanted to, maybe even less, we've developed, we're on the verge of a vaccine for something so impactful. I don't know if we've ever accomplished that in such a short amount of time before as a society, as a global society.
I don't think anybody in the human race has seen, and it sounds like I'm being grandiose here, but I'm just being accurate. I'm a scientist, okay? It has not happened before in the human race, going back through history, that people have been able to mobilize scientifically. I know we make a great deal of fuss, and appropriately, for our first responders. They are out there every day. They're doing wonderful things. There's another group, I'll call them secondary responders, okay? They are the scientists and the biotechnology people who are moving this ball down the field, to use a football analogy. They are moving this ball down the field like a hurry-up offense to get down to that goalpost and make a difference that is literally going to save hundreds of thousands of lives in America alone, if not a few million lives. So, yeah, I mean, these right now are the heroes we're not talking about, but they deserve a big pat on the back. And many of them are right here. I know these folks. Many of them live in Yorktown. Many of them live in Westchester. And there's a whole biotechnology cluster here in the Hudson Valley that includes the counties around us that has been phenomenal. You can look at Regeneron, which we all know about, just a few miles to the south, and yet they're not the only ones. There are many that are smaller companies that are doing this kind of work. Fantastic.
It really is just amazing. I want to touch, briefly on some of the precautions and guidelines. And I think you've said it, I've said it before. People are tired of hearing it, and I'm tired of saying it, but I keep saying it. Wear a mask, wash your hands, social distance, and if you're not feeling well, stay at home, right? Those are the four that here in Yorktown we keep preaching. Can you comment on the importance of adhering to those precautions and guidelines? And if there are any others that we should be taking as the caseload in Yorktown continues to go up?
Sure. Over 100 years ago, when that swine flu hit, we had nothing. But we conquered it basically with the 4 W's. I like to call them the 4 W's. Mm-hmm. Wear a mask, wash your hands, watch your distance, and walk away from groups of people. Don't stay in groups of people for more than just a few minutes if you can avoid it. When you go shopping, make a list ahead of time so that you don't linger in the aisle saying, what else do I need? We all know how to make lists. We all know how to run through a supermarket in the 10 minutes before it's about to close late at night. You make a quick run. You go up and down those aisles. Many of the markets now have directional arrows so that you're not passing other people most of the time. And I also tell people, don't beat yourself up about it. Do the best you can, because for the majority of us, it has worked. As I've said, I know Yorktown. We are a sensible community populated by sensible people. There's a lot of common sense going around. And when you've accidentally touched something and then you touched your face. When you've made a mistake. Don't beat yourself up. Just keep doing the best you can and feel good about the fact that most of the time it's working.
This community has done, I think, just an amazing job, despite the adversity and challenges of 2020. I think of so many examples. Most recently, we are able to collect both food donations as well as monetary donations to feed over 100 individuals, 100 families, really, who otherwise wouldn't have a Thanksgiving meal. And I want to thank members of our fire department, Jeff Wilson in particular, who's headed up this cause for a long time. But as you said, Yorktown, we are very sensible people. We don't back down from a fight either. And we're in a fight. And we've been in a fight really since March. But we are always stronger when we're together. And we've gotten through so much this year. We've gotten through so much in the past. But we're going to get through more of this if we continue to stay together, work together, look out for each other, and be there for each other. And your precautions, the the 4 W's, I wrote them down. I think they're great. Those are great reminders for our residents as we continue to get closer to Thanksgiving. And we heard earlier Dr. Ambler's perspective on Thanksgiving. I'm going to be sharing the county has released guidelines, suggested guidelines for Thanksgiving. I think you know one of the authors of that. And it's just really important that we remain vigilant and make responsible decisions, because those responsible decisions, one, could mean a matter of life and death for someone, depending on the severity of the virus that they catch. But two, and I keep saying this, we want Yorktown to stay open. We want our schools to stay open. We want our businesses to stay open. We want our houses of worship to stay open. And so if we want to allow Yorktown to stay open, then we have to continue to follow the precautions that we continue to hear both from Town Hall, the county, the state, and our friends on the federal level. And of course, to my good friend, Dr. Ambler, I can't thank you enough for taking, I know how busy of a schedule you have. I know, I think about, for those who don't know, Dr. Ambler and I were able to put together a medical mission down to Puerto Rico with some friends of ours after Hurricane Maria. And just watching you during that time and again this time, it's just spectacular that we have someone of your knowledge and intellect and experience at our disposal to help us through these very challenging times. So I genuinely want to thank you for being such a great friend to the town of Yorktown and to the entire state and country for that matter, because I know, like I said, you're doing this a lot. You're interacting a lot with other communities and other leaders and helping educate the residents of our region to the best of your ability. So I really do thank you for your time.
Well, this is a real pleasure. And in closing, I know so many people are thinking, are we going to do Thanksgiving by Zoom? Do we need another Zoom or video Thanksgiving? And that doesn't sound real exciting. In fact, a lot of people are getting tired of it. But my little sister sent me something she found on Facebook, and I think it's a wonderful slogan. It says that a Thanksgiving on Zoom is still a lot better than Christmas in the ICU.
Yeah.
So let's think about that.
Yep.
We don't want anybody in the ICU this Christmas. So let's just cool it on Thanksgiving. Thanks again for having me, Supervisor, and everybody in Yorktown. Hang in there. We're going to get there.
And we're going to get there together. Dr. Ambler, thank you so much for your time. Our town genuinely appreciates it. We wish you and the other Dr. Ambler well and a very, very happy Thanksgiving.
You bet.